Have you ever felt like you desperately need to have a bowel movement? You sit on the toilet. You push. You wait. But nothing, or almost nothing, comes out. And the strangest part is that you may feel the stool is right there, almost at the exit, yet somehow it refuses to pass. You may feel pressure in your rectum. You may feel bloated. You may repeatedly get the urge to go. And sometimes, instead of a normal bowel movement,
as
only
food leaves the stomach, it enters the small intestine, a coiled tube nearly 20 feet long, before moving into the colon.
Sometimes this is simply constipation. But sometimes, hard stool can become trapped inside the rectum
of the human colon. The final section,
impaction.
the rectum, is highlighted
and when
here,
that happens,
playing a crucial
simply
role in the
eating more
digestive
fiber
process.
Or repeatedly taking laxatives may not be the answer. In today's video, we're going to explain what actually happens when stool gets stuck in the rectum, why it happens, how
the
to
large
recognize
intestine
the
absorbs
warning
water
signs,
while specialized muscle contractions, known as peristalsis,
and what you should
slowly
never
push
try
the
to
forming
do
stool.
yourself. And most importantly, we'll explain when this problem needs urgent medical attention. Let's get started. What does stool stuck in the rectum actually mean? 1:15 to 3 o'clock. First, let's clarify something. Feeling like you haven't completely emptied your bowel does not automatically mean you have fecal impaction. Constipation can cause hard, dry or lumpy stools, difficult bowel movements, fewer bowel movements, and a feeling that some stool is still left behind. The rectum is the final storage area of the large intestine. Normally, stool enters the rectum and stretches its walls. Nerves sense that stretching and send signals to your brain. You recognize the urge to have a bowel movement. When the timing is appropriate, the muscles involved in defecation coordinate to allow the stool to leave the body. But when stool remains in the rectum for too long, more water can be absorbed from it. The stool can become increasingly dry, hard and difficult to pass. In some cases, a large, hard mass becomes lodged in the rectum. That's when doctors may describe it as fecal impaction. Cleveland Clinic describes fecal
As you can
impaction
see,
as a
the
buildup
left
of
panel
stool
demonstrates
that
a healthy
becomes difficult or
transit
impossible
with
to
relaxed
naturally
muscles,
pass,
while the right
often
panel shows
following ongoing constipation. So there's an important difference. Constipation means bowel movements are difficult or infrequent. Fecal impaction means stool has become severely stuck and accumulated. That difference matters because the treatment can be very different. How does stool become stuck? So why does this happen? There isn't always one single cause. One major factor is simply chronic constipation. If bowel movements
as the stool hardens in the colon, it becomes much more difficult to pass, leading to impaction.
Another factor is not getting enough fiber. Fiber helps add bulk and can help make stool easier to pass. Adults generally need around 22 to 34 grams of fiber per day, depending on age and sex.
When things slow down, it causes discomfort.
Increasing fiber gradually and drinking enough liquid to help it work properly. Low physical activity can also contribute. Your digestive tract is not completely independent of your overall activity level. Regular physical activity may help relieve constipation and support regular bowel movements. Medications can also play a role. Certain medicines, including some opioid pain medicines and other medications, can contribute to constipation. This is especially important if constipation begins after starting a new medication. But don't simply stop a prescription medication on your own. Instead, ask your healthcare professional whether the medication could be contributing and whether an alternative or preventive bowel regimen is appropriate. There are also medical and neurological conditions that can interfere with normal bowel function. And for some people, the problem isn't simply that the stool is hard. The muscles involved in emptying the rectum may not coordinate properly. This is sometimes called pelvic floor dysfunction or obstructed defecation. In these situations, a person may feel that stool is physically blocking the exit even when the underlying problem involves the muscles responsible for evacuation. The surprising sign, watery stool. Now here's something that surprises many people. You can have a large amount of hard stool stuck in the rectum and still experience something that looks like diarrhea. Why? Because liquid stool can sometimes move around the hardened mass. Imagine a solid blockage inside a narrow passage. The solid material doesn't
move.
Okay,
the metformin here, are you still
taking that
material
twice a day with meals? Seep
Yes,
around
doctor,
it.
exactly as prescribed.
This can produce
and
watery
no significant
stool,
side effects
leakage,
we need to discuss.
or staining. Cleveland Clinic specifically identifies diarrhea or watery stool around an impaction as one possible symptom of fecal impaction. So if you're severely constipated and suddenly start passing small amounts of watery stool, don't automatically assume the constipation has been cured. It may be worth discussing
the drug
situation
targets
with a
specific
healthcare
receptors in the intestinal wall, causing the muscle contractions to decrease in frequency and strength.
Significant pressure. And especially if you're experiencing pain, nausea, vomiting, bleeding, or worsening abdominal symptoms. What does it feel like? The symptoms can vary. Some people experience a strong sensation that they need to have a bowel movement, but can't. Others may experience rectal pressure or discomfort.
This visualization demonstrates
abdominal bloating or
peristalsis,
pain.
the slow, wave-like muscular contractions that move digestive material through the colon as water is reabsorbed.
You might feel like something is physically blocking the passage. Some people experience reduced appetite or nausea. And in more severe cases, there can be dehydration, confusion, or bleeding. Cleveland Clinic. Another important clue is incomplete evacuation. You have a bowel movement, but immediately afterward you still feel as though something remains inside. That symptom doesn't automatically mean impaction. But if it keeps happening, especially together with difficult stools and prolonged constipation, it deserves attention. There are other conditions that can create similar sensations. For example, inflammation of the rectum can cause a persistent urge to have a bowel movement even when little stool is present. This symptom is called tenesmus.
As you can see here,
Nick
this
notes
area
that
highlighted in
proctitis can
red
cause
is where the
urgency,
inflammation is occurring.
constipation,
We need to focus
rectal
treatment on
discomfort,
this specific
pain,
section.
and tenesmus. Nid. So don't assume every feeling of something stuck is automatically a fecal impaction. The cause matters. When should you stop trying at home? This may be the most important section of today's video. If you're constipated, there are situations where self-care may be reasonable.
Watery stool
But there are
every
also
day for a
warning
week.
signs
Are you
that
sure it's
should
just
not be
the
ignored.
adjustment? I find that hard
According
to
to
believe.
NIDDK,
Based on the test, the adjustment period is
constipation
the most
accompanied
likely
by
cause,
rectal
yes.
bleeding, blood in the stool, constant abdominal pain, inability to pass gas, vomiting,
It's a
fever,
persistent discomfort,
unexplained weight
doctor,
loss,
especially
or
after
other
meals.
concerning
I've also
symptoms
noticed some
warrants
changes in
medical
my
evaluation.
appetite.
Thank you for sharing
Think
that.
about
We'll figure
that
out what's
carefully.
causing this together.
If you cannot pass stool and you cannot pass gas, if your abdomen is becoming increasingly painful or swollen, if you're vomiting, if you have significant bleeding, or if you develop fever, severe weakness, dizziness, or confusion, don't keep repeatedly trying stronger and stronger home remedies. Get medical help. These symptoms can sometimes indicate something more serious than simple constipation, including an intestinal obstruction or another condition requiring prompt treatment. And there's another important rule. Severe or persistent symptoms should not be diagnosed from a YouTube video. The purpose of this information is to help you recognize the situation, not to replace an examination. What can actually provide relief? So what happens if stool really is impacted? The answer depends on where the stool is, how hard it is, how severe the symptoms are, and whether there are complications. Healthcare professionals may use different approaches. One possibility is an enema, which introduces fluid into the rectum to help soften or evacuate stool.
And how long has this
Another
been happening?
approach can involve an oral
About 3
osmotic
weeks now.
laxative such as polyethylene glycol, depending on the situation and medical advice. In significant fecal impaction,
Tenesmus is the
healthcare
persistent
professionals
feeling
may
of
need
needing
to
to empty
physically
the
remove
bowels,
the impacted
characterized by
stool,
straining
a procedure
and
called
cramping,
digital
even if there is
disimpaction.
little stool.
But this is important. Do not assume that you should perform digital disimpaction on yourself. Cleveland Clinic specifically
tenderness
states
when I
that
press
digital
down here?
disimpaction
No, I
should
don't
be
feel
performed by a
anything.
trained
Okay,
medical
good. Let's have a
professional.
listen.
Improper attempts can injure the anus, rectum, or intestine and can cause bleeding, tears, or other complications. In severe cases,
We're looking
medical
at the
treatment
abdominal
may
imaging
need to
here.
occur
This
in a
bright
healthcare
spot
setting.
indicates the issue we
And
discussed.
if there is an
Is that gonna
obstruction
require
or
surgery?
complication,
No, we believe
the
this can be
treatment
managed
has
with
to address
medication.
the underlying problem, not simply force stool out. This is why the phrase, "I just need something strong enough to make me go," can sometimes be dangerous. More medication is not always the solution. First, you need to know what is causing the blockage. What about laxatives? Laxatives can be
The
useful for
saturation is stable
constipation.
now. Let's get him up
but
to CT
different
when
types
ready.
work differently.
Understood.
NIC lists several categories, including fiber supplements, osmotic agents, stool softeners, lubricants, and stimulant laxatives. The mistake is assuming that taking more will necessarily produce faster
It's right
relief.
here, Mija.
It won't always.
It's really
And
bad.
taking more than recommended can create problems. Cleveland Clinic warns that taking too much laxative can cause adverse effects and recommends following the product instructions or healthcare provider's advice. If you suspect a true fecal impaction, particularly if you have significant symptoms, it's better to speak with a healthcare professional rather than repeatedly escalating laxatives yourself. And never combine multiple bowel cleansing products simply because the first one didn't work quickly.
Means you must call us right away.
What you can do to prevent this from happening again. Once the immediate problem has been addressed, prevention becomes extremely important. First, fiber. Gradually work toward an adequate
the intestine
daily
becomes
intake rather than
obstructed when
suddenly
it twists
consuming
upon
a huge
itself.
amount.
A condition known
Fruits,
as a volvulus.
vegetables,
The muscular
legumes,
contractions
whole
or
grains and nuts are examples of fiber-containing foods. Second, fluids. Adequate fluid intake helps fiber do its job.
This model shows where the blockage
Your
is
individual
occurring.
fluid needs
The first
can
step
vary
is
based
usually
on
an
age,
enema to clear the
activity
lower
level,
section.
climate,
Is that
and
something
medical
I can do at home?
conditions. So follow your healthcare professional's advice if you've been given fluid restrictions. Third, movement. Regular physical
An
activity
enema
may help
introduces
improve
fluid into the
constipation.
colon through
Even
the rectum
simple
to
regular
clear the
movement
bowel.
can be useful for people who are otherwise sedentary. Fourth, don't repeatedly ignore the urge to go. NIC recommends going to the bathroom when you feel the need and allowing enough time to have a bowel movement. And there's another simple technique worth knowing. A small footstool
This
under
blue
your
one
feet
is a
can change
gentle
your
option to
position
start
on the
with.
toilet
What about this
and may
orange
make the
bottle?
process
Is it
more
stronger?
comfortable.
It is, but let's
goal
try this
isn't to
prescription
force.
first.
The goal is to allow the pelvic muscles to relax and coordinate. A simple daily routine. For people who struggle with recurring constipation, consistency can matter more than dramatic remedies. Try establishing a regular bathroom routine. For example, some people find it useful to try having a bowel movement after breakfast because eating can stimulate colon
dietary
movement.
fiber and this specific
NIC notes
medication.
that trying to
And
have a
it's
bowel
safe to-
movement about 15 to 45 minutes after breakfast may help some people establish regularity.
All right, if you could please turn
Give
onto your
yourself
left
enough
side,
time.
bend your right
Don't
knee
sit
up
there
towards your
indefinitely.
chest, like
Don't
this,
repeatedly
and I'll
strain.
adjust the drape for your
And
comfort.
don't turn every bowel movement into a battle. Your goals should be a predictable, comfortable bowel pattern. If you're repeatedly needing laxatives, enemas, or manual assistance to empty your rectum, that's a reason to discuss the problem with a healthcare professional. Sometimes the issue isn't simply diet.
I
It
understand
may
this is
involve
uncomfortable to
medication
discuss,
effects,
but it is
pelvic
very
floor
common.
coordination,
We have
nerve
several
function,
treatment options
anatomy,
that can help you
or
manage
another
this effectively.
gastrointestinal condition. The biggest mistakes to avoid. Let's quickly review the biggest mistakes.
Starting the day right with a
Mistake
bowl of
number
hearty
one,
oatmeal,
assuming
packed
watery
with
stool
fiber
means the
and topped with
blockage is
fresh
gone.
berries and whole
It may
grains for
simply be
sustained
liquid stool
energy.
passing around an impaction. Mistake number 2, repeatedly increasing laxatives because you want immediate results. More isn't automatically better. Mistake number 3, trying to manually remove deeply impacted stool yourself. Digital disimpaction is a medical procedure and can cause injury when performed incorrectly. Mistake number 4, ignoring severe symptoms. Pain, vomiting, inability to pass gas, bleeding, fever,
Look at
severe
that light
weakness
through
or
the
confusion
trees.
deserve
It's
medical
perfect.
attention.
It's stunning.
And mistake
We
number
should come
5,
here more often.
waiting until constipation becomes a recurring crisis before looking for the underlying cause. So if it
Using a
feels like
small
stool is
footstool
stuck
like
in your
this
rectum,
really helps
remember
maintain
this.
a comfortable and
It
natural
may be
posture.
ordinary
It
constipation,
makes a big difference.
but it may also be fecal impaction, a condition where hardened stool becomes trapped and difficult or impossible to pass normally. The key is recognizing the difference. Don't panic. Don't force. Don't repeatedly overload yourself with laxatives. And don't attempt medical procedures on yourself. If symptoms are severe, persistent, or accompanied by warning signs such as significant abdominal pain, vomiting, bleeding, fever, or inability to pass gas, seek medical care promptly. NID. And once the immediate problem is resolved, focus on prevention. Adequate fiber. Appropriate fluid intake. Regular movement.
So based on the chart in this model, the
Healthy
recurring
bathroom
issue is right
habits,
here in the large intestine.
and finding
see.
the
Is there
underlying
anything else
cause
I
of
should be doing?
constipation
We should
keeps
review your current
returning.
medication and diet
Your
plan.
digestive system is giving you information. The important thing is learning when that information means
it's never too late
I
to
need
start
a healthier
living
routine,
your healthiest life.
and when it means I need medical attention. If this video helped you understand something you were embarrassed to ask about, consider sharing it with someone who may need it. And remember, there is nothing embarrassing about a bowel problem. Knowing when to act can protect your health.